over to Facebook. Good evening, everybody out there, and welcome to this Endometriosis Summit Facebook Live this evening. We are continuing our series in race and endometriosis, but this time we have expanded into race and fertility. We have three incredible guests with us tonight who are going to speak from the heart. Please welcome Dr. Melvin Thornton. Can you go ahead and introduce yourself?
Thank you. Yes. As you mentioned, my name is Dr. Melvin Thornton, and I guess it's hard for me to say this, but I've been in the world of fertility for almost 30 years now. I finished my fellowship in 1993, so it's coming up on 30 years, and I've seen all the changes in the world of fertility, the world of treatment of endometriosis, various treatments that have come and gone for fertility. So I'm here tonight to answer any questions you have and give you a real perspective on, what's it like to undergo treatment if you haven't undergone treatment, what's it like to have an initial consultation, and not to be afraid to actually consult with a fertility doctor about whatever. The best time is when you feel like it's the right time for you, but just to tell you, don't be afraid and don't delay your treatment. So that's who I am. I'm looking forward to meeting everyone and talking to everyone.
And Dr. Thornton, where do you join us from?
Yeah, I'm actually, that's a good question. I'm actually in New York. I have a practice in Connecticut as well as in New York City, but I'm flattening the curve here in New York City.
Flattening the curve. I hope we are all flattening the curve. Please welcome also Kat. Kat, can you introduce yourself?
Yes, my name is Kat Haagenson. I am a writer and a blogger. I work primarily on the blog Fempower Health. And I'm also a creator, so I have a YouTube channel as well. And mostly what I do and my work is focused is spreading awareness about my personal struggles with endometriosis and with infertility, and just to help empower women that if you're going through the same things, that this is what it looks like and this is what it entails and this is what my journey is. So just kind of to give hope and to encourage other women that are going through these same struggles.
Awesome. Thank you for being here. And where do you join us from tonight?
I am from lovely South Texas and San Antonio.
And we hope that you're safe where you are. I've been watching the news and Texas is getting slammed.
Yes, we are, but we're working on it. I'm staying safe. My family is staying safe, and we're all doing what we can to just flatten that curve and continue to be safe.
Excellent. And Claudia, welcome to the Endometriosis Summit Live. Can you please introduce yourself?
Of course. Thanks for having me and for hosting this awesome webinar. I think when I think about endometriosis and I think about fertility and I think about race, each of them by themselves is huge. And so this really is an awesome platform for us to kind of really see the intersection of all three of those. So thank you so much. My name is Claudia Campbell. I'm originally from Kingston, Jamaica. I moved to the US, specifically in Connecticut 18 years ago now. So I've been here for 18 years. I'm actually an actuary by trade. That's what I do in my regular job. But as far as endometriosis goes, I first started exhibiting symptoms when I was 13. And I was put on birth control, and I wasn't actually officially diagnosed until 15 years later when I was 28, while my husband and I were trying to conceive, and it had been, 2+ years and we had not yet conceived. And after a couple rounds of fertility treatments, my doctor suggested why not, do a laparoscopy, and endometriosis was found. And so it took about 15 years for me to be diagnosed. And once I was diagnosed, I did have 5 laparoscopies in total over, being intermixed with 7 different IVF cycles. So I did undergo 7 different cycles of IVF before we were blessed with our 2 girls that we have now. And even after having children, when everybody said your endometriosis will go away, that obviously did not happen. And I had another laparoscopy again before I was finally able to find Dr. Sinervo through Nancy's Nook. And I had excision surgery with Dr. Sinervo last year and have started pelvic floor physical therapy as well. So that's me, and that's my endometriosis infertility story as well.
Wow, that's quite the story. Doctor, is it common that people will come to you being infertile for so long without a diagnosis of endometriosis?
Yeah, it's very, very common. A lot of women don't even think of, as I say, for infertility is really asymptomatic. I mean, there's no one sign or symptom that you can say, this is why I'm infertile, which is very frustrating for a lot of patients because, a lot of times you go to the fertility doctor, you do the thorough evaluation, you don't find anything wrong. And that's the most disappointing thing for women, is that there has to be something wrong. Why can't I get pregnant? And many of those times when your standard workup is normal, and by taking a really good history and doing a good physical examination, you can lead to a potential diagnosis of endometriosis and, make the official diagnosis via laparoscopy. And many times just doing the surgery can improve their chances for fertility.
Right, and the Endometriosis Summit adds this plug. We do advocate for excision of endometriosis, and we are big believers in the new I Care Better system, which is going to video vet excision surgeons so that everybody is getting standard care. But we worry that not everybody can access any kind of care. Kat, I wonder if you could share with us a little about your story and how you were diagnosed and how long it really took to get diagnosed.
So when it comes to me and my endometriosis, I started to exhibit symptoms as early as 12. So pretty much I feel like the onset of menstruation for me is when I began to display symptoms. And I didn't really understand it. My family didn't understand it. There wasn't enough education and awareness about it at that time. So the only solution was birth control. And I was pretty much told that it was my lot in life to just struggle with painful periods and to struggle with all the pain that I was going through, and that the only solution was birth control. And hence why I got on birth control. And I was on that for many, 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 many years until I was married in 25. And then I got off birth control and I was like, okay, I'm ready to start my family and I'm ready to start working on getting pregnant. And that's when I was faced with obstacle after obstacle. I wasn't able to get pregnant and I struggled with infertility for many, many years. Many of the doctors that I reached out to, they were just like, oh, it's okay, it's gonna happen, don't worry about it. I really didn't get any solutions from any of the medical professionals that I worked with, unfortunately. And it just kept going and going and going for many, many years. And unfortunately, it led up to my symptoms progressing to forming 2 very large chocolate cysts and me having to get an operation done before endometriosis even entered the chat. No one ever discussed the possibility of it being endometriosis. No one ever mentioned that it could be that. It was only due to the fact that I had those chocolate cysts and they were worried that they were actually cancer, so that it could possibly be ovarian cancer, that I was able to have a surgery and get it diagnosed properly. And that's when they were able to discover that I had endometriosis.
It's interesting to me that chocolate cysts are one of the cardinal signs. They're one of the few times that ultrasound is actually reliable in diagnosing endometriosis, even though you need surgical diagnosis. But nobody mentioned the word endometriosis to you, even going into surgery. Dr. Thornton, do you see that as a common experience of many of your patients?
I mean, I think the biggest thing, Kat and Claudia are expressing, is about education, not only to the patients, but educating pediatricians and gynecologists. Every year I give a review course for pediatricians, and I try to stress them about endometriosis and signs and symptoms of endometriosis in adolescents, because what typically happens is that the first doctor you see for your symptoms of endometriosis is going to be your pediatrician. And the pediatrician is clueless. They say, oh, you just have painful periods, we're going to give you birth control pills. And so you just kind of go on and go on the pills, just like Kat was mentioning. So the key is educating pediatricians, educating gynecologists, and to be open and have a important discussion that this is a possibility. Because a lot of times you don't even mention it. They say, okay, well, I just think you have painful periods, just go ahead and live with it, instead of going through, this is what I think you could be having. there's a potential you can have endometriosis. You know, you can say, here are the different treatment options that we have, and make you or your family aware of the different options that are out there for you to proceed, and say, hey, by the time you're in your mid-20s, when you're ready to have a child, see a fertility specialist right away.
So Dr. Thornton, I love how you're educating. We're going to hook you up. We have to introduce you to Endo What, who has developed a kit that you can use to go to pediatricians and to nurses with, to be in their office to educate on what endometriosis is, and on and for nurses, it actually provides CEUs to do that kit. So we have to, if you're out in the field educating, we got to get you copies of that kit.
All right.
What I found really interesting is you have 3 women with endometriosis sitting here in this webinar, and you said the words, lots of doctors say, go ahead and live with it. And I didn't put the gallery view on out of respect for the fact that you're an MD, but the rest of us were all sitting here nodding, right? Kat and Claudia, were you both told this is what it is? Some people have to live this way?
That's exactly.
Oh, absolutely.
Yeah. So because we're here as part of our series of race and endometriosis, I want to get down to some more in-depth questions. Do you feel that people said to you, this is what happens to some Black women, that Black women have painful periods, or maybe one day you'll find out you have fibroids, but you need to live with it? Do you think there was a culture of you need to go ahead and live with this?
I definitely do think that, you know, for me, I was told that as a Black woman, I had a higher chance of having just dysmenorrhea. And so as a result, I was going to have painful periods essentially for my entire life. And so at some point they would say, well, maybe you'll develop fibroids, or you'll find that you have fibroids or cysts, and it's normal as a Black woman. And we do find higher rates of dysmenorrhea. And so just, you know, whether it's, you know, taking some Tylenol or doing a hot water bottle, essentially I was told that this was going to be my story until menopause.
Wow. And Kat, how about you?
So I was told that fibroids were common for Black women, and that it's something that I was probably going to have to face and deal with. And especially in my case, since my mother actually had fibroids when she was pregnant with me. So I kind of expected that. When it came to period pain, it was more, I was made out to be, or I was always felt that I was kind of trivialized. And it was kind of like, you know what, you're being dramatic. Like, that's kind of more of what I felt with what I was going through with my pain and with my endometriosis symptoms, is just that I was paranoid. I was seeking attention. My pain was not believed. When I would discuss it with various different doctors, they were kind of like, oh, you know, it cannot be that bad. You cannot be in that much pain. So it was more of the kind of gaslighting my symptoms and not listening to my pain points that I experienced, and just having the pill pushed on me over and over and over again when I would try to seek solutions for what I was experiencing.
So I wonder how many of our Facebookers and how many of those of us joining us on Zoom were told they were just being dramatic and they were just seeking attention. If you were told that, you should hit the like button, because I was told that. Claudia, were you told that? Kat, you were told that. We have a ton of hands coming up here on Zoom, a ton of likes coming up here on Facebook. That definitely, unfortunately, is the narrative in endometriosis. And then I find what happens is, or in menstruation, that forget, even most people don't realize they have endometriosis. And then by the time comes to go and try to conceive, you don't realize that there's a problem, and you're already having, you know, you're already steps behind everyone else because the disease is inflammatory and deepening. Yeah, no, we're not seeking attention. Take that message home tonight.
Sallie, I'd like to add something else, if you don't mind, from a medical perspective, particularly for African-American women, is that many women go to the emergency room, they go to their doctors because of the pelvic pain. And the number one diagnosis they get is what we call pelvic inflammatory disease, or salpingitis due to chlamydia, gonorrhea. So many women with endometriosis go through life with a diagnosis of pelvic inflammatory disease. So by the time you go to see your gynecologist or go to see your fertility doctor, you know, they say, have you ever had a pelvic infection? It's like, yes, when I was 17, 18 years old, I was told I had this pelvic infection. So now the diagnosis goes a different direction instead of the direction towards endometriosis. So once again, it's about education, and that, you know, you can always distinguish endometriosis because women come into the emergency rooms, they don't have a fever, okay? Where someone that has pelvic inflammatory disease, they will come in, they will typically have a fever. So the problem is that in African-American women, no matter if they have a fever, they don't have a fever, they're always diagnosed with pelvic inflammatory disease. That puts the stigmata on you for the rest of your life.
Yeah, and it does not advance care. In our last series, all of the speakers actually mentioned how poor the emergency room care available to them was, and that most of them will leave most of our speakers that were on last time, they'll leave their neighborhood to actually go to a better emergency room in the hopes of being taken seriously. You know, so it doesn't work out well. And actually, we have a comment here on Zoom saying they were diagnosed with pelvic inflammatory disease, and endometriosis didn't get mentioned for years and years and years afterwards. Do you feel that your race has affected access to care? I know access to endometriosis care is terrible in the first place, but Kat or Claudia, how do you feel that race has affected your access to care?
I feel for me, I think the biggest part is the fact that my pain was just even more pushed down. I feel that I was made to feel like I'm making so much of this pain that I should be able to handle this. I should be able to manage it, that I'm strong. You know, the strong Black woman stereotype, I felt that that was pushed on me and pressed on me a lot. And that because of that, I should be able to manage this pain and suppress my symptoms without any help, without any intervention. Never did I ever receive any prescription medication to help with pain, nothing. Like, it was only, you just manage it, you're gonna do fine, it's gonna be okay, it's nothing to worry about, you've got this, you're strong. That's pretty much what I was told within the medical community, with the medical professionals that I saw, and sadly within a lot of, you know, people that I was meeting outside of the medical community. Just the, I guess, stigma of our culture and our society kind of pushes that on us to say that if you're struggling or dealing with abnormal period pain, debilitating period pain, and any type of like severe chronic pelvic pain, you just are making it up, and you need to find a way to deal with that. That's the only solution. It can't be anything wrong with you. It couldn't possibly be due to an underlying condition or a disease or anything. It just has to be that you're making it up, you're being dramatic, and no one really wants to get to the root cause of what is causing that pain and what's causing those symptoms and how it's actually impacting your fertility. Like, no one talks about any of these things, you know. And I think that's one of the biggest things that kind of angered me when I recently got my diagnosis, because again, I only got my diagnosis in this past October is when I had my surgery and got my diagnosis of endometriosis, and I lost an ovary. So it was a lot of like grief and frustration that I felt like if I would have been listened to when I was younger, that all of this could have been prevented. I could have kept my ovary, you know what I mean? I could have had better chances with fertility and not be facing the things that I'm facing now at 35. So I feel like a lot of the stigmatization of being Black and the stigmatizing of period pain played a lot in with my failure to get a proper diagnosis and to get properly treated.
Yes, thank you for sharing. Claudia, do you feel that race affected your access to care?
Yeah, I definitely feel a similar way as Kat has expressed, because I've been in the emergency room before where I've been labeled as a drug seeker. I've been, in my doctor's office when I would be complaining about pain. And then when I would try to push back or get assertive in my care, I would get labeled as the angry woman. So, the label of the angry Black woman who is getting upset because she's not being heard. Or I would hear, maybe what you need to do is go and see a psychiatrist because you're making it up. It's all in your head. And, maybe if you did that and you got some medication that would manage your stress, maybe even then you would conceive. So really it was just the implicit biases that allowed, me to not be believed by, many in the medical profession. And also, when I sit back and I think about it, you hear a lot, well, you shouldn't have a problem being pregnant. You shouldn't have a problem getting pregnant. And so I think as well, just the general myth or misconception that, oh, Black women are very fertile, and so that alone as well did create some of a barrier from an access perspective, because what it did for me was it took quite some time before I even went into, to a fertility specialist or to a fertility office, because my doctor wouldn't refer me because I shouldn't have had a problem, even though, we had been trying to, to conceive for well over a year. It won't be a problem for you because, Black women are fertile.
I mean,
Dr.
yeah, it's just, these stories are, make me very sad, because these are the same stories I heard 30 years ago. And they haven't changed. And I think the biggest thing is, we can try to educate physicians as much as we can, but just like you guys, you have to be, self-active. You have to say, this is what I think I have, research, because many times, the system is set up for women not to be heard, because, you think about going to the gynecologist, they're so busy. I mean, you have nowadays, you got 10 minutes with the gynecologist the most. Most of the time is spent probably with the nurse taking your vital signs, that they don't have time to listen to what you're trying to say. Many gynecologists still do pelvic examinations, and we know that pelvic examinations are terrible at picking up things that are wrong with the ovaries. So, I mean, women have to advocate for, hey, you know what, I got these symptoms, I should at least get a pelvic ultrasound just to make sure my ovaries are nice and healthy, make sure my uterus is healthy. Because many doctors will blow you off, and like I say, they will, for Black women, it's going to be pain-seeking, or it's going to be, okay, this is just your pelvic inflammatory disease is acting up. So it's just sad, because things haven't changed on that front. And what's interesting is that in textbooks, and physicians are taught that endometriosis is very rare in African Americans. So your average physician has that knowledge, and they say, oh, it can't be endometriosis because it's very rare in African American women, and they miss the diagnosis, and you guys suffer because you go years and years without a diagnosis. But like the education, we can educate physicians as much as we can, but we have to educate friends and family, have them be proactive in their care. A lot of African American women don't seek treatment just because they've been frustrated. They were turned away from other doctors. Say, well, I'm not going to go see another doctor because they're going to treat me the same way. And then you have the stigmata of you don't want to discuss it with friends and family because they're going to judge you and say this and that. And so you're forced to deal with all the pain of endometriosis, the pain of infertility, to yourself. And then that brings on a whole host of problems as well.
Yeah, I actually have to say, none of us think endometriosis is rare in Black women, because we wouldn't be here. I think that is something that is extremely damaging. But the last session we had on 5 speakers, 4 of them, I believe, had thoracic endometriosis. So we're taught that that's so rare, and yet just a random sampling, it happened to be that I didn't pick them because they all had that. It happened to be, and that's a sign of pretty severe endometriosis. And so it's mind-blowing to me that we're still saying, somebody still walks into an emergency room and they assume without pretty much listening to them that they have pelvic inflammatory disease based on what they look like, and then that follows them the rest of their lives. It's really, really hard. Kat, did you want to share something? You have.
Oh, no, I was just listening, but I could add that what is also funny when it comes to why it took like 18 years for me to get diagnosed, my sister had endometriosis. So my oldest sister actually had endometriosis. And when I learned this, I would always share this information with my doctors and say, you know, my sister has endometriosis. Maybe what I'm experiencing could be this. And they still were like, no, it couldn't possibly be that. No, you're fine.
I mean, even though you have a 1 in 7, you have a 7-fold increase of having a relative that has endometriosis, but no, it wasn't you.
Could be possible.
I mean, I also found, how many years did you try to conceive?
Wow.
Before you were diagnosed?
Since I was 25, so between the times of 25 till about 30, 31, because that's when I just stopped. That's how long me and my husband tried to conceive.
So 6 years, and no one could, and your sister had endometriosis, but no one could, but you just needed a psychiatrist. It is mind-blowing to me that no one could put those dots together.
And furthermore, no one even told me anything about seeking a fertility specialist. No one even told me about that. No one even discussed any other options such as IVF or IUI. None of that was discussed with me. It was all, you know, you should be fine. Maybe it's your husband. Maybe it's him. It could possibly be him. No one ever wanted to do any extra or additional testing on me. It was either pushed off onto, no, you're still young, it's gonna happen, or, you know, it's probably your husband. That's probably what's going on. No one ever discussed about referring me out to a fertility specialist or a reproductive endocrinologist. None of that. No one mentioned any of those things to me.
Now, April Christina, who was not able to join us tonight, but who was the inspiration behind this panel, said the exact same thing. I wonder, Dr. Thornton, is it common that women of color are not referred out to fertility specialists? Because I tried for 6 months, and in a minute I was sitting in a reproductive endocrinologist's office. Is it common that we don't refer out? Is that something that is happening?
Yeah, it's very common for African American women not to get a referral to a fertility specialist. The other thing that's common that you see in African American women is that they become socially isolated, and that you know, normally for Caucasian women, you'll talk to your friends, say, hey, look, I'm struggling with this, and they'll say, hey, go see my doctor. I saw this doctor. But for African American women, it's not like that. Like I say, it's an internal struggle. You don't really discuss your situation with friends. You don't even talk to your spouse about it because you don't want your spouse to feel any different towards you. So it's a big social stigmata that I wish I can get to the root of, but even the years I've been doing this is very difficult. I've had patients come in and say, well, I prayed about it for years. My parents told me to pray about it. My friends told me to pray about it. And I always say, listen, you know, God gave us fertility treatment to help women like yourself, you know, so it's a big challenge. And, you know, things like these will help women understand that it's not in their head, help them understand that they do have an issue, and it's important to see a fertility specialist early on. I would always say, skip the gynecologist, go right to fertility specialist. So even if it's early in the diagnosis, just go see a fertility specialist because they'll take better care of you than a gynecologist.
Well, unless there are vetted eye care better surgeons, those surgeons take very good care of you. But I wonder, Kat and Claudia, was there a lot of shame in your family situation not being able to conceive?
So I think for me, it was something that just wasn't even talked about at all. And it was understood that it was going to happen naturally. And I think even if not necessarily in my own immediate family, in my community, I was, you know, it felt like I was the only one that wasn't able to. And what I came to realize afterwards was, as I was going through it, there were more people that actually were struggling to conceive, but because nobody talked about it, everybody just stayed in shame. Right. And so everybody stayed in shame because everybody, you know, those of us that were struggling all assumed we were the only ones, you know. And so, you know, it was one of those things where, you know, in my family, we just assumed that, okay, it's going to happen at some point. It's going to happen at some point. And it just was something we never talked about. And I remember when we finally walked into, you know, the fertility specialist office for the very first time, you know, one of the first things they have you do is you have to go to this big info meeting before you can even get seen by a doctor. And I remember when we walked into the info session, you know, my husband and I walked in and there had to have been maybe about 60 people there in the very large room. And we were the only Black people in the entire room of about 60 people. And so we looked around and we didn't see anybody that looked like us. And so we wondered, okay, what's going on? And then when you walk out of the doctor's office and you see the wall of success where everybody has, you know, the families that are on the wall, there are no Black families on the wall. And so then you get the pamphlets, there are no Black families in the marketing material. So I think all of that helps to contribute to the shame as well, because somewhere along the line, you feel like as a Black woman, I should be able to do this. Everybody else must be doing this, right? Because when I walk into the office in the waiting room, we were there maybe six or 7 years. I can probably count on one hand the amount of times there was another Black couple or, you know, Black person in the waiting room at that time as well. And so I think all of those kind of help to contribute to the underlying shame you feel when, you know, you're not able to conceive.
Well, you jump to my next question, which is that the picture in the media and online and that many doctors' office, not Dr. Thornton's office, but put out is that infertility is white and it's wealthy. And so it's always, you know, and how does that affect the Black community from seeking care when they need it? And how did it affect you on your journey? Kat, do you want to answer?
I think for me, because there was just a barrier to entry when it came to cost. And I think since it was never discussed with me and it was never given as an option and I was never properly educated on all these alternative methods, I automatically dismissed it myself and said, it can't be for me because I won't be able to afford it. It's going to be out of my pocket. It's not going to fit as far as our finances. So I kind of disqualified myself because I was afraid to even go and find out more and ask the questions because no one properly vetted me and no one was like, you know what, seek a fertility specialist. This is what you need to do. And no one in my family had ever done that before. So they didn't really have any experience and couldn't really guide me or tell me where to go. So I think a lot of that held me back from even seeking those options in my fertility journey.
Right. And Dr. Thornton, what do you know, is fertility care now in New York, there's been some changes, but do you feel that fertility care is out of price range for most patients?
Yeah, unfortunately, many patients, unfortunately, not all the states mandate fertility coverage. Some states will mandate it for companies that have over 100 employees, which occurred in New York State. It has had a new mandate, but then that kind of leaves out, you know, women who are self-employed, women who work for companies who are less than 100. They're left to fend for itself. And what many people don't realize is that fertility treatment, A, is very expensive and the success rates are very low and it takes time. You know, even in the ideal candidates who's going to do IVF, someone in her, say, late 20s, early 30s, she's only looking at about a 60, almost 70% chance of being successful. And, you know, when you're shelling out money for, and the other thing is that it's a gimmick. A lot of people don't understand because they'll say, oh yeah, IVF costs $5,000, but they don't tell you how much the medications cost. They don't tell you how much it costs to freeze the specimens. All these different things they don't tell you. And so at the end of the day, when you say, well, it's going to be $18,000, $20,000, they say, well, if your insurance doesn't cover it, you can take out a loan. And so now you're taking out a loan for something that's not 100% successful. It makes everyone frustrated. But it's something that we have to face as a nation. Infertility is a disease. We have to come to that. We have to treat it like any other disease, and they should have full coverage. People still shouldn't have to pay out of pocket for IVF treatment in today's society.
Absolutely. How far into your fertility journey did you hear the word excision? How long did it take? It took so long to be diagnosed, but either Kat or Claudia, how long did it take you to hear the word excision of endometriosis?
For me, I only learned about excision and the possibility of it when I was researching it myself. So no medical professional, no one told me about it. It was something that I found through my research, and that when I was discussing with my surgeon about what would happen, I was asking him questions about excision, and if they found endometriosis, would they be excising it? So it was actually me, just through research, that found about excision.
Kat, I'm curious because I'm nosy like this. What did the surgeon say? Sure, I'll excise it?
Actually, I was super blessed and super lucky to have a really good surgeon who was like, I'm going to do everything to make sure that we get you healthy and preserve your fertility as much as I possibly can, because I want you to live a healthy and happy life. So he was open to any and all things. So that I'm very lucky that I had him as a surgeon and that he operated on me. He was actually really great.
Right. We find a lot, because we're the Endometriosis Summit, that patients are seeking information, crowdsourced information, and they know enough to say, are you going to excise it? But then when I actually look at their pathology and surgical reports, it's some guy or some surgeon who is basically doing ablation or cautery and calling it excision. So that's why, I find crowdsourced education is much further past where medicine is. So you got very lucky. Claudia, how long and how many, it probably took you at least 8 years to seek out that word excision, right?
For me, I never found out about excision until after I even had children, and I was in a situation where I was finally blessed with children after so many cycles of IVF, and I had no quality of life, and I wasn't able to be a good mother, and I was still in debilitating pain, still in the emergency room. I had gone back to my surgeon, who said, after you have children, you'll be okay, and he did a uterine ablation in 2017, because he said, well, when you get a uterine ablation, you'll be fine. And when the pain came back, it wasn't until I started looking online and digging, and I found Nancy's Nook 2 years ago in 2018 that I even knew of the word excision. I had no idea what that was. And so when I went back to my doctor at the beginning of last year and I said, I think what you did, was really ablation, and I need another surgery where you will truly excise the disease. And he said to me, yeah, we'll do that. We'll definitely do that. And I started asking him certain questions, and I said to him, okay, what about the bowel adhesions that I saw on some, previous surgical notes? And they said, well, we will bring in a specialist if we have to, but we're going to do a colonoscopy, and your colonoscopy doesn't show anything, so we don't think we need a colorectal surgeon on staff, because all we'll do is that part we can ablate, but we'll excise the remainder. But we'll do ablation on the portion that's on your bowels. So it was really, that was when I said, you know what, you're not going to touch me again. And I decided that I was going to wait. And even though I was going to be in pain for a bit longer, they would have taken me in surgery the next week. I said, you know what, I'll wait 10 months if I have to. And I ended up, going to, the CEC in Atlanta, which was the best decision I ever made.
Right. I find it amazing. The two of you were able to access care. I always worry about the person who is home. They are covered in shame. They're afraid to talk to anyone about it. They can't see a reproductive specialist without a referral, and they have nowhere to turn to, which is why we have the Endometriosis Summit, hoping that we can get some level of education out there. I have a question. It's within the topic, but I wonder for Black families that have turned to adoption, maybe Dr. Thornton can help us a little bit with this. Is it harder to adopt as a Black family than as a white family?
Yes, definitely. I've had a lot of patients where I've referred them to adoption agencies, and it's just frustrating because it takes a long time. You're expected to adopt a baby that's every baby's desirable, so don't take this the wrong way, but you're expected to adopt a baby that has special needs instead of saying, I just want to, have a journey for my family. So it's a large barrier. And, the other thing is cost. It's very expensive for adoption, attorney fees and things like that. So a lot of African-American women are priced out of that as well. I mean, you're priced out of doing in vitro fertilization, you're priced out of doing adoption. So it becomes overall frustrating for a lot of African-American women.
Yeah.
And I would add to that, Sally, that for me, we actually considered adoption strongly when we realized that we were going to struggle with conception. And for us, the cost of adoption was actually quite daunting too. And so it felt like, even though in vitro fertilization was also costly, it felt like, okay, if I have to get a loan, which we ended up doing, and, maxing out credit cards, all those things, it still felt like if we got one cycle to be successful, then it would still end up being cheaper than the overall long-term cost of adoption, unless we wanted to go a different route. And so for us, we did consider adoption. And, when we got to cycle number 6, IVF, and it didn't work, we were almost there. But, we said, all right, one more time. But really, it definitely is something that we did consider. And in doing so, it's not something that was an easy thing to do either. There were a lot of hoops to jump through.
Lots of hoops to jump through. Did you feel as a Black woman that your fertility was less valued in the practice that you were working in? The fertility practice that you were working in?
I think for me, initially, so I ended up having several different reproductive endocrinologists over my journey. I think the very first, person that I did work with, the very first doctor that I did work with, when I got into the unexplained infertility category, it wasn't that it necessarily wasn't valued, but it was more of, they were actually the ones that brought up adoption very quickly in the process, because it was almost like, well, the chances that you're going to get pregnant are very small at this point, and we don't know why, so you may as well just, go and look at adoption. And so they brought that up very quickly, and I felt like I was still so early in the journey with a fertility specialist. I felt like, why wouldn't you have at least tried to figure out what the root cause was? Because, when you've been with a fertility specialist for only a year or so, and you're still in the unexplained category, to be essentially farmed out so quickly, you feel like, is it that you're saying that my body is just not able to do this? What is it? And why can't this be something that we can work on a solution for? Instead, your response is, well, you know what, you may as well, go into the adoption realm. And I think initially as well too, when you speak with some medical professionals, at least for me, you do hear, well, there are a lot of Black children that need to be adopted, and so there is this, in a way, yes, undervaluing you in terms of what it is that your body can do and your overall fertility, but at the same time, it's being there's some intersection with, what is perceived to be the current state of affairs in the adoption world or in the foster care world, and where you may be better suited over there than continuing to try. And ultimately, at the end of the day, adoption is a beautiful thing. It really does. It really is. I just couldn't understand why that couldn't be my choice, and why it was the doctor that was pushing me in that direction kind of so early into my fertility journey.
Exactly. Do you, Dr. Thornton, do you get patients that come to you from other practices, so maybe you're not their first stop, that have felt that they weren't valued because of the color of their skin?
They will never come out and say it directly, but the code word is, "Wow, you're a brother." So I typically know what that means when they say that. And as an African American reproductive specialist, it's very difficult for me as well, because there are a lot of patients. They see my name as Melvin, and they think I'm a older white guy, and they come into the practice, say, "Wait, this is not the person I want to make the appointment with." So it goes both ways, the struggle. But I think the key thing for African American women is to be persistent, and there's not, don't just take what you're given. If you're not comfortable with the first physician that you see, make an appointment for the person that's in the other doctor in the practice if you don't want to leave the practice, or look for another physician in the community. And since this is a educational forum, just want to touch a little bit on adoption. We all think of adoption as a standard. I'm going to adopt a baby, but more and more out there's something called embryo donation. There are thousands of embryos that are abandoned every year in the United States, and now people are turning more and more towards embryo donation. It's a much more affordable process. There's less, there's less challenges, because in the regular adoption world, there's so many things. You have to be, Caucasian and your mid-30s in order to adopt a baby. If you're single and you're 45, you're never going to get a baby to adopt, but you would definitely qualify for embryo donation. So I just want to throw that out there as another form of fertility treatment.
Right. So while you're talking about embryo donation, I will share this little snippet that when I was going through my fertility treatments, all of which were unsuccessful, but the doctor said, when the last cycle failed, the doctor said to me, "Oh, come on." And I was single, a single under 40 white woman with a good education. "I'll be able to get you an embryo donation, no problem." And I kind of looked at him, and this is already, I'm an old lady, so this is a while ago. And I kind of looked at him and I said, but everybody, it should be the same playing field. It shouldn't be because I have a better, and it isn't. And so it's been going on a very long time, systemic racism within the gynecology world, certainly, but certainly within the fertility world, that some people are unfortunately perceived as valued more. And we are trying to make a difference, at least by discussing the topic. I wondered, Kat, did you feel that your fertility was less valued while you were going through your fertility struggles?
I felt ignored, and I felt dismissed, and I felt like no one took my questions about my infertility and about my desire to start my family seriously, and that they just kind of passed the buck and you know what, you'll figure it out. And that kind of led to me kind of giving up. Honestly, I kind of just gave up, because I was like, you know what, no one's helping me. I'm not getting any other resources. I don't know what else to do. I've done everything that I can in my power that I know how to do on my end. So that's a lot of the reason why I kind of just gave up, and why I personally stopped even seeking medical help at one point in time, just because I was just so frustrated and disgusted with the treatment that I was receiving from my doctors. So I just kind of gave up on it, because I felt dismissed, I felt patronized, and I felt ignored, and my pain points and my fertility and my desire to start a family and my desire to get resolution for the pain and symptoms that I was going through wasn't valued at all.
I'm very sorry for that. I mean, I'm so very sorry I created this whole entity, because I don't feel that anybody should feel that way, but I am very, very sorry. And every time I hear that story, and I unfortunately hear it every time I do one of these lives, it breaks my heart. And I hope that one day there is better care out there, so that somebody is diagnosed within the first 6 months, and not really because they've given up and it's the last ditch diagnosis, and it happens to be the correct one. And it breaks my heart. I believe that every person should have whatever they want in terms of fertility. If they want 100 kids, or if they want 1 kid, or if they want to adopt, or if they want, it really makes me sad that you were treated that way. I'm very sorry. I want to ask, how do you think that we could change that? How do you think that, if you had a perfect way of creating, how do you think we could change how you were treated?
I think having medical professionals actually listening to their patient pain points and actually listening, not just half listening, but active listening, where you're actually, okay, so this is your family history that you're sharing with me. Your sister had endometriosis and you're having these painful periods. Ding, 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 there may be something there. And let's explore that option. So I think that the more that medical professionals actually listen to their patients' pain points and what their patients are going through, and listening to what their goals are concerning their fertility, their quality of life, and all the things that we share with our doctors during our consultations and our appointments, and actually do the work of getting to the root cause, a lot of endometriosis can be diagnosed in the early phase before it's allowed to progress and cause severe issues, such as in my case where I had to lose an ovary. So I think that listening is the most important thing to me, is the listening part.
Absolutely.
You know, can I share something with that? Let me share something with that. It's interesting because, give you a little history lesson. Back in the day, there used to be 5 things for the fertility evaluation. You want to check make sure one was ovulating. You want to check to make sure the sperm was healthy. You want to make sure her tubes are normal. Make sure her age is the right age. And then the 5th thing was a laparoscopy. So every woman that was suffering from infertility, that the workup was normal, everyone got a laparoscopy. And the reason why I kind of went by the wayside is because, you know, a lot of women without symptoms, you do find endometriosis, but most people don't. And insurance companies weren't covering the laparoscopy. So fertility doctors were faced, well, do you want to spend $5,000, $6,000 for a laparoscopy that may or may not show anything, or just go into fertility treatment? So a lot of the endometriosis that's misdiagnosed now would have been picked up many, many years ago, just because we used to always do laparoscopies. And the same conversation has been happening in the 90s. We talked about, should we ablate or should we excise? The reason why most doctors don't excise is because they're not comfortable enough to do the excision surgery that needs to be done. So it's important for women to find the pelvic surgeon who's very good at endometriosis surgery. And, you know, there are a lot of gynecologists who are good at surgery, but, you know, you need to find the right surgeon for you that's going to be able to take care of your endometriosis and excise what needs to be excised.
Right. So, Doc, we hope that I Care Better will be a huge resource to the endometriosis community. We also are big fans of Nancy's Nook, and it kind of goes back to what Kat was saying. Was she was the one who found the word excision, and so Nancy's Nook is the type of place where patients were furious with the state of endometriosis care, and they created their own group to educate people on what to actually look for. So it's amazing to me that it's been in the patient's hand and not in the doctor's hand. Claudia, what would you like to see to change how to navigate the fertility community for Black women and a Black couple?
So I think for me, one of the things I think of is I definitely want Black women, Black couples to be able to get into the fertility specialist earlier. You know, I think this is where, you know, doctors really do need to listen to their patients, and we shouldn't be waiting, you know, 18 months, 24 months, and, you know, really having to advocate for our own selves and be hunting down reproductive endocrinologists on our own. I do think I would want the medical community to understand that, okay, yes, there is some type of underlying condition. Let's say you don't know what it is. Let's say you don't know it's endometriosis. Let's say you even haven't been diagnosed. If, your patient's having painful periods, if your patient is, undergoing symptoms of something, you're treating a symptom of something, it's very likely that your patient may have trouble conceiving. And so in that case, it shouldn't be when your patient is, 30, 35, that you're now having these conversations. I think the conversations need to happen sooner, because I think that is one of the reasons why, we suffer once we actually do get to the RE, is that we are going there very late in the process. So that's one thing. I think that education is important. And then I think also, if something is found, for example, if in my case, they did find endometriosis a couple years into my fertility journey, but, I do think if you're not comfortable treating the endometriosis, don't, have us do millions of cycles, while we figure it out, because each of those times, it's a financial struggle on, the couple. It's a mental struggle as you're going through each of the losses. You're doing laparoscopies and doing ablations in between. Something's not working. And so, what I think, as I think about, the fertility journey, I think, first of all, we do have to start sooner. And if we understand that, research would indicate that a Black couple is twice as likely to experience infertility, for example, then, if you're sitting in the office, and you have a Black couple in front of you, and they communicate that, okay, we're looking to try to conceive. All right, it's been a couple months, you have some other symptoms. I need to get you into somebody. And then as soon as we figure out that there could be an underlying condition, we need to actually treat that underlying condition instead of continuing to do fertility cycles in the hopes that IVF is going to work. Because you end up like me doing IVF 6-7 times and having, failures, in not getting pregnant, and then getting pregnant and not being able to have a successful pregnancy before, we even get to some type of a resolution. Because the truth is, for me, for my story, my story, and and ultimately being able to be blessed with my girls now, is not the story for most people, and so there, you're dealing with income disparities, you're dealing with all these different things, and I would say that the likelihood that the average person is going to be able to do 6-7 cycles of IVF, it's not something that even if you're able to take out loans and do all of these things, the mental strain that it puts on you is something that I personally wouldn't wish on anybody.
Thank you for sharing. So before we leave, I want to know, we end with Claudia was present this year. Hopefully we're going to be online in March of 2021, because I'm compulsive and I have to plan now. I can't wait to see what's going to happen with COVID. But I'd love to know, Kat, how would you change the narrative of endometriosis, especially endometriosis and race?
Wow. Endometriosis is real, and you should believe women's pain. They're not being dramatic. Well, you know what? I take that back. I think that I can only speak for myself, but I am being dramatic, and I do want attention, because I do want more people to know that endometriosis exists and that it is real. My pain is real. My symptoms are real. Everything that I went through is real. And it's a serious condition, and we need to increase the awareness, and we need to have open, frank conversations about endometriosis so that more women are educated and they know more about this disease, and they can go to their doctors and say, you know what, I'm exhibiting these symptoms. I have a family history of endometriosis. We need to go through the diagnosis process to see if indeed this is endometriosis. Because for me, I don't want any woman to go through anything that I went through with my journey with infertility and my journey with endometriosis. I think that that is something that can be stopped super early if we have these conversations, we increase the awareness, and more medical professionals are doing their due diligence behind the scenes to properly diagnose women early on.
Awesome. Dr. Thornton, how would you change the narrative for endometriosis and race?
The way you change the narrative is that number one, like I said in the beginning, you got to start with the pediatricians. You have to let them know endometriosis starts off in adolescence. You got to help them refer to the gynecologist to get an early diagnosis. And then the other thing is important is to educate physicians that not every Black woman that comes into the emergency room or to your office with pain has pelvic inflammatory disease, that they do have endometriosis. You should look for other causes such as endometriosis in women that have pelvic pain. And the other thing is that I need the women to be proactive. If you're not happy with the one doctor, go see another doctor until you get to where you need to be, and not just kind of settle for someone just because you don't want to offend anyone and things of that nature. Find a doctor that's right for you, get your diagnosis, and get treatment early on.
Yeah, Nancy Peterson of Nancy's Nook, she calls that vote with your feet. So vote with your feet into a doctor's office that really begins to listen to you. Claudia, how would you change the narrative for endometriosis and race?
So I would change the narrative by saying endometriosis is real, endometriosis in Black women is real, and there is the phrase out there that we are strong Black women, and I want to say that that is a very true statement. And strong women feel pain. I want to make that very clear. And we need to be heard and we need to be understood. I want to have, as Black women, I want us to feel strong enough to voice our opinions, to voice what we're saying, to voice what we're feeling. And I want to ensure that, we are heard as well. The pain is real. There is no faking it. It's not in our heads. We don't need psychiatrists. We don't need, we don't need you telling us to go and take some more narcotics. We don't need stress balls. We want you to understand us. We want you to listen to us, and we want you to treat us. And that's all we've ever wanted.
I hear you. So Claudia, how can people reach out to you?
I can be found on Instagram. I'm at EndoFierce on Instagram. I'm also on Instagram at Claudia R. Campbell. That's my personal page as well, where sometimes I share tidbits there as well too.
Great. And Kat, how can people reach out to you?
So you can find me on Instagram at FemPower Health Blog. You can also find me on YouTube at FemPower Health, and you can find me online at fempowerhealth.com.
Awesome. And Dr. Thornton, how can people reach out to you?
Yes, they can reach out to me directly through my website, drmelvinthornton.com. There's always a place there for questions asked directly. I'm always frequently at the website looking for questions and answering questions, so feel free to reach out.
We've also had someone from the crowd point out to us that there is a support group called Black Women and Infertility, and it's an online support group that's great for anyone seeking support that we cannot offer through the endometriosis. If we can't offer it through the Endometriosis Summit, that's another resource that you can look on. We hope that our entire panel will be present on October 25th for our Reproductive Immunology Summit. And we hope to expand this discussion into a discussion about access to care. And then we will join you next March, also online, for a panel on the history of gynecology and how that affects access to care today. And we will be back with the third in our series of race and endometriosis at some point. I have to line up my speakers, but our dream is to talk a little bit about why the history of gynecology impacts endometriosis care for people in the Black community. Thank you so much for joining me this evening. I really value everyone's opinion. Your voices were amazing, and I look forward to seeing you back here another time.
Thank you.
Thank you for having us.
All right, awesome. Have a great night.
You too. Bye-bye.
You too. Bye.